of the season. We know a child from New Haven County died this month. Details are still limited about the child in the case, but we do know they were no older than 9 years old.
Yeah, we're now joined by Dr. Lucia Benzoni from Hartford Healthcare. And first, Dr. Benzoni, thanks for joining us, of course. And while we can't get any more details about this specific case, let's talk about the flu cases you're seeing as a physician. How are the pediatric cases trending this year compared to years past?
I've been in practice for a long time, and this year is definitely way more flu than I've ever seen, except for maybe during the swine flu season. But this season is more marked because we are on top of a very bad RSV season, and of course, we are still worrying about COVID. So this is probably one of the worst seasons I've ever seen. I graduated medical school in 1991. I've done pediatrics since then, and this is definitely one of the worst flu seasons.
Well, is it too late to get the flu shot if our children haven't? Okay. And how long will it take to build that maximum immunity after receiving one?
2 weeks. 2 weeks. But we've had a number of children that have come in and gotten the flu shot, and 2 days later developed the flu. And of course, the flu shot's not going to protect you in that scenario. But if you have you're exposed to the flu when you're 1 week into your flu shot, you are going to have a less severe case.
Can children get the flu more than once in a season?
It depends on if there's varying strains floating around. And right now we're seeing mostly influenza A. Of course, there are varying strains of influenza A. The short answer to that is yes, they can.
Mm-hmm. Okay. And if your kid has like a sniffly nose, should we be running into a clinic and getting them tested right away? Like, what should we do?
No, not every cold needs to be tested for the flu. The flu has fever, generalized body aches. These kids look down. Oh. They don't look good. They're not eating. We've had some kids presenting with vomiting and diarrhea this year also, and then develop the fever and the congestion and cough later.
All right, good to know. As a mother with a 3-year-old, sometimes they can't tell you how they're feeling, so that's good to know. Thank you.